Doctor, we'll move on to the next question.
Hi ma'am, I am Vidya from Dowden Healthcare. Is there any advantage of using any particular method to avoid pregnancy?
Well, I'll come to the biggest advantage of using a method for contraception. I suppose it's peace of mind. You're more comfortable. But then there are certain advantages which each method has. Now, if you are having sex with somebody whom you're not very sure of, maybe a condom is very useful because that will prevent sexually transmitted infections. Even pills have been made to sort of help certain people. So you have contraceptive pills which can be given to breastfeeding mothers because a regular contraceptive pill might reduce the chances of her successfully feeding the baby. So you have tailor-made pills for certain people. We have pills meant for people who have other problems like, say, excessive acne, that's pimples on your face, oily skin, excessive facial hair. So you have each pill which is different and each one is tailored for certain groups. And when you're looking at IUDs, that's your intrauterine devices, you have devices for people who have light periods, you have devices for people who have heavy periods, there are devices for people who have more pain during periods. So there are a lot of options which are actually available. And if you are seeing the right person, they might actually go into these problems which you have and find out what is the best option. So you've got, it's like a big cafeteria where you have a lot of options.
Okay. So can you just tell me more about IUDs or intrauterine devices?
Well, intrauterine devices are synthetic implants which actually are kept inside the woman's uterus. Now generally this is for somebody who already has had a child because it's much easier to place it there. The most common one is what everybody knows as copper T, which contains a small amount of copper and it's T in shape, so that's why it's called as a copper T, and it's been there for a very, very long period. Most of the copper Ts which are available work for between 3 and 10 years depending on what make it is of.
That means once it is inserted, you don't have to remove it for another.
That's correct. So it's like once you put it, you just forget it. So maybe only when you need a change, say after 3 years or 10 years.
Or when you're planning for a child or something?
Yeah, that's fine. If you have one child, put a copper T. Whenever you want a second child, just remove it. So you are at peace till then and you don't have to worry about that.
Just forget about that.
And especially about people who keep on forgetting taking their pills. A copper T is a boon that way.
Does it have any side effects?
Well, everybody thinks that copper T is a very dangerous thing because you hear a lot of people with painful periods and more bleeding during periods. No, but that's a very small fraction, and these are the people who actually come out and talk about it. Whereas most people who are happy about it, well, you won't expect a woman who has had a copper T and she's comfortable with it to go and talk around and say, look, I've got a copper T. So that's a problem. It's negative publicity which creates a lot of problems. And those people which do have problems also, most of them, the problems do settle down in 2 or 3 months' time. So if you are patient enough, maybe that's something which will be very useful for you.